All right, we're going to review this case here that came into clinic. This patient has a 5th metatarsal fracture. Believe it or not, this patient was treated at an outside institution non-operatively and given a bone stimulator. And so the major thing that I see with this is the gap in between the 2 fracture ends is just so wide. Typically, we like to think, 2, maybe 4 millimeters of bone, 4 millimeters of displacement can end up with healing, but with a gap this large, particularly the patient being out 6 months now, this is a surgical case. So what I plan to do is, I plan to make an incision, I plan to get down to the fracture site, debride or remove any hypertrophic callus, any scar tissue, anything out of there so I get nice and down to bleeding bone. Then I'll go ahead and take a drill and I'll kind of fenestrate into the area. And when I say fenestrate, I mean I'm going to take a drill and kind of go into the bone and essentially turn this old fracture into something that's new and acute, and bone is happy to kind of grow in that area. I'm also at the same time going to take a little bone graft out of the heel. I use something called a trephine. It's about 7 millimeters in size, and I remove some bone out of there, and I'm going to pack that bone in. Once I have that bone packed in, I'm going to use a clamp. I'm going to apply the clamp here and here. That's going to cause this to compress. And finally, I'm going to place a screw that is perpendicular to the fracture site, likely bicortical, across the fracture itself. And if I need to supplement that with a recon plate, that's just a small plate, I will do just that. And that plate would sit on the outside of the bone. That plate would also have screws that essentially secure the fracture. So most times I like to address these in the acute setting. It's a lot easier. It's a shorter recovery for the patient. But in this particular case, I'm going to have to do a bone graft. I'm going to have to apply a screw and then likely a plate in order to allow for this to heal. So if you have a fracture and there's a big gap, sometimes surgery is the best option initially. When the edges are close together, non-surgical options are available, but certainly if there's a large gap, things may need to be addressed with a surgical fixation. So, hope you learned something. Peace.